Acne treatment across the lifespan. Hello everyone, and thank you for tuning in. In this episode, Dr. Jonette Keri will share some highlights about acne evaluation and treatment across the age spectrum. Dr. Keri, how do we differentiate and grade acne across the age spectrum from newborns to preteens?
Sure. I'm going to go in order from the youngest child to the oldest in this age group. We're going to start with the neonate. With the neonate, the question is whether or not it's truly acne. And a neonatal acne picture is usually between the ages of 0 and 6 weeks of life. So when you look at patients, you want to pick out the age. That'll be the first thing, and see how old they are. And then you want to look at what type of lesions they have. In neonatal acne, a lot of times you won't see true comedones, true little blackheads or whiteheads. Instead, you'll see little tiny little pustules. And that's why some people don't believe that neonatal acne is true acne like we know it. They think it could be a variety of other conditions. In fact, it's often treated with things like ketoconazole cream. It usually does not scar. There are rare cases in neonatal acne where you see true comedones, where you see things that look like acne in older children. And in this case, you want to think maybe there's some type of variolization going on or some type of increase of androgens, and you refer to an endocrinologist. So with neonatal acne, you want to look at the age. You want to look at the type of lesions that there are. You also want to look for the distribution, because neonatal acne is generally just on the face and a little bit more on the cheeks. Sometimes you'll see it on the chin. You won't see it much on, if at all, on the trunk. So that's neonatal acne. If we go on to infantile acne, again, we're going to look at the age. And the age is going to be from about 0 to 1 year outside of that neonatal period. And you're going to look for the lesion again, and this time you might see true comedones, things that look like acne, excuse my language, little blackheads and whiteheads, things that look like they could be acne. This usually will predispose to someone having, I shouldn't say usually, can predispose to someone having more acne in their teenage years. And how would you take care of these patients? Well, again, if it's mild, you want to look for treatments that you would use for mild acne. You can use topical antibiotics and benzoyl peroxide, being very careful not to get the benzoyl peroxide anywhere near the child's eyes or mouth or anything that could irritate them. Sometimes we also will use a low-strength retinoid, maybe adapalene cream a few times a week. With these infantile acne patients, again, just like with the neonatal, if you see any signs of androgen excess, you want to refer to a pediatric endocrinologist. And we'll talk more about that in the second question, but to bring that up again. In the third group of children, this is the group of children that you want to be most on the lookout for acne, and that's the age of 1 to about 7 in girls and about 8 in boys, so about 1 to 8. And this is, we call this mid-childhood acne. And the thing with mid-childhood acne is basically children shouldn't have acne during this period. This is a time when they should be free of acne. Again, about 7 in girls, the age of 7, and 8 in boys. Androgens at this point, which can drive acne, should be low. They should be stable. So you should have low and stable androgens during this mid-childhood period. If you see evidence of acne, whether it be just on the face, but you might also see it on the chest or the back, this is the time you really want to be on the lookout of thinking that somebody might have some type of endocrinologic abnormality, such as maybe precocious puberty or some type of virilizing tumor or something going on with them that's making them have androgens that are making them develop acne. So mid-childhood acne really shouldn't occur between the ages of 1 and 7 in girls, 1 and 8 in boys. If you do see it, you want to treat similarly to other acne, but you want to refer to an endocrinologist during this period. And then the last period that we're talking about in the childhood acne is when we have sort of that pre-adolescent acne, and that's between the ages of 8 and 12. And again, you're going to see acne over the face. You may start to see it over the chest, the back, on the trunk areas. And with pre-adolescent acne, the important thing that you want to look for is acne is okay in this period, but if you see someone 2 points you want to look for. One point is if you see them starting to scar, and they may scar, you don't want to be afraid to treat because of the fact that they're young. You may have to use systemic agents such as antibiotics or even isotretinoin if someone is starting to scar. So you don't want to say, oh, they're only 9 years old, I'm not going to treat them. So that's the one thing during pre-adolescent acne. And then the other thing, again, you want to make sure that they aren't being a little bit accelerated in their development. So there are terms, and one of them is called premature pubarche, and that's a big word, or big words, which pretty much means the development of pubic hair in girls before the age of 8, and in boys before 9 years of age. And why do you want to watch that? Again, even though this isn't as scary of a period as that age 1 to 7 or 8, this is the age of 8 to 12, you may still uncover children with endocrinologic abnormalities. So if that's the case, then you want to refer them to an endocrinologist, or an endocrinologist, I should say. And again, pubic hair can be the definer. If you also see development of the breast or development of the genitalia, then that would also give you an idea that they may be developing a little bit too fast. Now, why is this so important for us to define? Well, specifically in young girls, if you define a condition called polycystic ovarian syndrome, which you can define in the ages of 8 to 12, it's a multi-system disease where you can have a tendency towards earlier diabetes or heart disease. If you define this early in young females, and you get them to the doctor who helps them with these conditions that all go under polycystic ovarian syndrome, I found this so interesting. You can actually, by getting their androgens in check and not having excess, have them so that they are taller. A lot of these patients will be shorter, and they can actually be taller if they get their androgens in check by being evaluated by an endocrinologist. So in that 8 to 12-year-old little girl, if you see someone who has acne, they look like they're developing a little bit quickly, and you go, maybe I better send them to the endocrinologist, you may be able to help them not only with their skin, but with their possible predisposition to diabetes or even make them taller in the long run. So that's something to think about during the time of the 8 to 12-year-old.
When is it necessary to refer to other specialties, particularly endocrinology, for childhood acne that may be associated with an underlying endocrine disorder?
Sure. So when you want to refer to endocrinology is any time you see development in the child, no matter the age, neonatal, infantile, prepubescent or pre-adolescent, whenever the age, if you see something that looks like the child may be developing too fast. But specifically between the ages of 1 and 7 in girls and 1 and 8 in boys, you really shouldn't see acne during that time because the androgens, the male hormones, should be low and stable. Also, we talked about if you see the development of pubic hair in a little girl below 8 or lower, or a little boy 9 or lower, then you should consider sending for evaluation for an endocrinologist. So that is a specific thing you can look for. But also anything that makes you concerned if you see even a baby come out of the womb that has something that looks like an advanced time for them, the baby having some type of evidence of androgen excess, then you would then, of course, work with the endocrinologist and your staff.
What should we be using more of and less of in treating acne across the age groups?
So when you look at, that's a very good question. What should we be using more and what should we be using less in treating acne across the age groups? If you look at pediatricians, and this has been studied, pediatricians use a lot less retinoids than dermatologists. And since pediatricians are seeing a bulk of the acne before the dermatologist, I think that we should probably be using a little bit more retinoids. And remember, we can even use a mild retinoid in that infantile acne patient if we need to. So you just don't use it as often and you don't use as much of it. But I think we should be using more retinoids. I think we should treat with washes more often because we can usually get young people, to wash. Even a 5 or 6-year-old will probably wash wash with the right soap if we can, meaning cleanser, I should say, rather than soap. So we should look for things that patients can use easily in that age group, and washes and cleansers are one. I would use more retinoids in general because you can use them at almost any age. As far as other things that we could do, the last thing I would say about treating acne in the younger age is what I had said earlier, is don't be afraid to treat because of the age. If you're concerned about scarring in any way, shape, or form, and isotretinoin has been used even in infantile acne to prevent scarring. So I guess the final point would be don't be afraid to use systemic agents, and if you are a little concerned, refer to a physician or a center where they're not afraid to use it. And I'll say it one more time, isotretinoin has been used for infantile acne and should be used if there's evidence of scarring or the potential to scar.
How do you educate patients and families to deal with the psychological aspects of acne as well as with treatment adherence?
Okay. That's a very good question because you have to educate people. I think one of the most important things you can do with a young person when you're taking care of them in any way with a child is to try to connect with them. So you might want to initially ask them about themselves, and then you have to see what's bothersome to them. They may be a 10-year-old little girl who has a little acne on her back and doesn't want to wear a bathing suit. Or it might be a little boy who has a little acne on his chest at the age of 9 and doesn't want to go swimming again because he doesn't want anybody to see the bumps on his skin. So I would try to connect with them and then find out what's bothersome to them. It's going to seem like a recurring point, but always look for scarring and then work with the parent and the child to educate them about scarring, but not in a way that scares them. You want to be gentle and say, we want to keep you looking good. You want to make your regimens easy. I used to give my patients too many things to do when I was a young physician, but now you want to make things easy. We talked about cleansers, washes, and maybe a nighttime leave-on that they can use. If we take pills, we want to make sure that we make it so that it's easy for the patient to take, maybe once a day rather than twice a day, maybe with their dinner meal, things like that if we use antibiotics. We want to educate them to what new pimples, and I use the word pimple in quotes, look like versus old stains, I use the term sometime, or hyperpigmentation. Some people use the word blemish, so that they know that the goal is to get rid of the active lesions and then take care of the pigmentation too, because if they see the spots staying there, they might give up on using their medicines. Last but not least, I use this when I talk to more teenagers, but can also help with some of these kids. I say that, to get things to be good, whether it be working out with your body or playing the piano or practicing whatever you do, if you play the piano or work out, you have to work at it. So if you want to be in good shape physically, and a lot of 10, 11-year-olds are already thinking like this, and maybe they do gymnastics, you have to practice. You have to keep doing things. Same thing with playing the piano. You got to keep practicing. With your skin, you can't expect it to get better if you don't do the work. You got to put the work in. And by work, we just mean using your medications regularly, taking your pills regularly if you have it, letting your parents know, and then letting the doctor know if something's not working for you, if you don't like it, so that we can find things that will work for you. Sometimes patients don't like the smell of a medication. Sometimes they don't like the way it feels on their skin, or it feels a little dry. So I use the analogy that you have to put the work in to have your skin get better, and then let us know, and we will help us, meaning the practitioner, know, and we'll adjust the routine for the young person.